Let's talk about fascicular blocks, different from bundle branch blocks, but still important because you will definitely see this on the EKG eventually. First, we're going to talk about the anterior fascicular block. Just remember, the fascicles are what come off of the left bundle branch. The anterior fascicle is a little bit straighter, it's a little bit more condensed, so you're going to have a more common anterior fascicular block than you are a posterior fascicular block. So let's go ahead and talk about the characteristics of an anterior fascicular block. Now what I want you to do is I want you to write this out kind of how I remember this, and this is how I wrote it initially when I first started learning it. Just draw yourself a T, kind of like that. Left anterior fascicular block goes on this side. Now the supporting criteria, or I'm sorry, the characteristics over here is going to basically be what you're going to look for an anterior fascicular block. So the first thing you're going to look for is a left axis deviation. The next thing you're going to look for is something called a Q1R3. Now what that means is you're going to have a small Q wave in lead 1 and a small R wave in lead 3. So you're going to have a Q1R3. The next thing you're going to have in lead 1 is you're going to have a positive QRS. Lead 2 is going to have a negative QRS, and lead 3 is going to have a negative QRS. One thing to remember about this is very commonly left anterior fascicular blocks are commonly associated with a right bundle branch block. So if you see a right bundle branch block, you should also look for an anterior fascicular block. So to complete our little T-square over here, you're going to have 1, 2, and 3 is going to be positive and then negative, or you can have positive and then negative, commonly associated with right bundle branch blocks. Now if you remember the anterior fascicular block criteria, then you're going to not have a problem with the posterior, and I'll get to that in a minute. Now the easy way that I remember this with my anterior fascicular block is I always put the anterior fascicular block on the left side of the T-square here. Look at the first two letters of the left anterior fascicular block. It's LA. You also have a left axis deviation, LA. It's also on the left side of this little chart here. So left axis deviation, LA for left anterior, left axis. That's the first supporting criteria right here, is left axis deviation. The second supporting criteria is the Q1R3. If you know the alphabet, Q comes before R in the alphabet, 1 comes before 3 in the number line. So Q1, R3. And then just remember up, down, and down for leads 1, 2, and 3. That's pretty simple. So left anterior fascicular block, left axis deviation, Q1, R3, up, down, and down, and it's commonly associated with a right bundle branch block. Let's look at a 12 lead here real quick and see what we see. General impression, if you look at your general impression, it actually looks good. When I first glanced at it, I didn't see anything that jumped out. Nothing excessively fast, excessively slow, or ugly. Calibration, unfortunately, they deleted our calibration markers off of here, but it's a standard calibration. Let's talk about our rhythm interpretation. We have a rhythm strip down at the bottom here. It's lead 2, and it looks like I have a P wave for every QRS complex. It looks regular. My QRSs don't look wide, so I'm going to say that this is a sinus rhythm. Let's see what the rate is. Let's start here. 300, 150, 100, 75, 60. So let's just say 70-ish for fun. So we're going to say it's a sinus rhythm at 70 beats per minute. My 7s keep coming out like 2s. It's not supposed to do that. Next, we're going to look at our R wave progression. Well, if you look up here in the precordial leads, you have negative, negative, and then it transitions. It's trying to transition to positive here, and then it looks like it kind of positive. So I'm going to go ahead and say that this is a good R wave progression. Your axis, I'm going to look up here in lead 1 and AVF. 1 is pointed up, AVF is pointed down, right together, left apart, gives us a left axis deviation. Bundle branch and fascicular blocks. Well, my bundle branch block doesn't exist because my QRS is not greater than 0.12 seconds. So we have a normal QRS, so 0 on the bundle branch block. How about a fascicular block? Well, let's look at any kind of supporting criteria. Are we pointed up in lead 1? Yes, we are. Lead 2? Yes. Lead 3? Yes. Do I have a left axis deviation? I have a left axis deviation. Now, do I have a Q1R3? So I want to look for a small Q wave in lead 1. There is possibly one there. It's kind of hard to tell on this digital copy. There's a small R wave in lead 3, so that means that we do have a left anterior fascicular block. Remember, the criteria for an anterior fascicular block is a left axis deviation, Q1, R3, 1, 2, and 3 is going to be up, down, and down. And we meet all of those criteria. So this is a left anterior fascicular block. So let's go ahead and finish the 12-lead interpretation here. Sinus rhythm at 70 beats a minute with a left axis deviation and a left anterior fascicular block. Let's look at the posterior fascicular block. Now, like I said before, if you want to remember this, just remember the anterior fascicular block and the posterior is almost backwards. So let's look at the characteristics, or the criteria is going to be a right axis deviation, an R1, Q3, leads 1, 2, and 3. 1 is going to be pointed down, 3 is going to be pointed up. The QRS complex is what I'm talking about here. Lead 2 is maybe biphasic, could be slightly up. It's kind of, lead 2 is kind of a variable. It could be a couple things. So let's go ahead and look at this little T here again, this table. Remember, the left anterior fascicular block starting out on the left side is a left axis, LA, left axis deviation, Q1, R3, and then leads 1, 2, and 3 is going to be up, down, and down, commonly associated with a right bundle branch block. The posterior fascicle, just remember, is going to be opposite. We have an RAD for right axis deviation, opposite than the left. Opposite of Q1, R3 is an R1, Q3. It's backwards. Lead 1 is going to be pointed down, lead 3 is going to be pointed up, and lead 2 is going to be biphasic, could be up. It's kind of a, could be a couple different things. So if you try to remember the anterior fascicular block criteria, then it'll be really easy just to remember the opposite for the posterior fascicular block criteria. Now, while the left anterior fascicular block is associated with a right bundle branch block, the posterior fascicle isn't normally associated with a right or a left bundle branch block. It can't be associated with a left, but it's not really associated with a bundle branch block at all. The only exclusionary criteria for the posterior fascicle is if somebody does have a presence of right ventricular hypertrophy, which is something that we'll talk about later, if somebody has COPD, if somebody has a pulmonary embolism, or if somebody is having an anterolateral wall MI. If somebody is having any of this stuff here on the 12 lead, a lot of times this is considered exclusionary criteria because it will mimic a left posterior fascicular block. Looking at our 12 lead here, it actually looks good. I don't see anything excessively fast, excessively slow, or ugly morphologies. Calibration markers are going to be over here on the side, so we're going to say that this is a standard calibration. Rhythm interpretation is going to be down here on the bottom, which is lead 2. It looks that we have a regular rhythm. P waves are married to the QRS complexes, and what is our rate? 300, 150, 100. So we'll say a sinus rhythm at about 95 beats per minute. R wave progression through the precordial leads is negative, negative. This is negative. That's still negative. Ew, that's negative. And then we finally have a positive down here. So you could say that this is a normal R wave progression because eventually it becomes positive. It's very late in the transition, though. Very late in the transition. Our axis, you want to look up here in lead 1 and AVF. Our axis is going to be, this one is pointed down and F is actually pointed up, right together, left apart. So we're going to have a right axis deviation. Do we have any bundle branch blocks? No, we don't, because all the QRSs are less than 0.12 seconds. So we do not have a bundle branch block. Do we have a fascicular block? Well, what is our posterior criteria? It's going to have to be a right axis deviation. Lead 1 is going to be pointed down, 2 can be who knows what, and 3 could be pointed up. And we also need to have an R1 Q3. Let's see if we have all that criteria. We do have a right axis deviation. We have a right axis deviation. We do have lead 1 is pointed down, 2 is pointed up, 3 is pointed up. And we have an R wave in lead 1 and a Q wave in lead 3, giving us our R1 Q3. So we do have a left posterior fascicular block. So let's finish interpreting this 12 lead here. So we have a sinus rhythm at 95 beats a minute with right axis deviation and a left posterior fascicular block. There are times where you may end up having a bifascicular block. Typically in a bifascicular block, what's going to happen here is you're going to have a left anterior fascicular block with a right, it's supposed to be C with a line over it, with a right bundle branch block, or you could actually have a left posterior, fascicular block with a right bundle branch block. You could also have a left anterior fascicular block with a left posterior fascicular block. These are pretty rare, these last two here. This first one, though, is pretty common, an anterior fascicular block with a right bundle branch. That is actually pretty common. So those are the times where you'd be considered having a bifascicular block. I don't teach this. I don't really concentrate heavily on this. I think there's enough information in here to get you through a very solid interpretation of a 12 lead. So let's do some practice here. What is your initial general impression whenever you see this? The first thing that I see is it looks wide. Calibration, we're going to look over here for our calibration markers, which are over here on the left side, so this is standard. Rhythm interpretation, I don't have a nice rhythm down here at the bottom, so I kind of have to go with looking at one of these other leads here. It looks like I have P waves that are married to the QRS complexes. What is my rate here? It's going to be starting here, 300, 150, 175. So it looks like I have a sinus rhythm at 75 beats per minute. What is my R wave progression? If I look at V1, it is positive. 2 looks biphasic. 3 maybe biphasic. So it looks like that it's actually that it's absent. There is no R wave progression. So we're going to have poor for our R wave progression. For our axis, I'm going to look at lead 1 and lead AVF. and lead 1 is pointed up, F is pointed down, so right together, left apart, so that's a left axis deviation. For bundle branch blocks, I can see that I have a wide QRS complex, so first place to look for a bundle branch block is going to be V1. If I start at my J point and I go backwards, I'm going up, which would indicate possibly a right bundle branch block. So do I have an RSR prime? I do, and I also have it in V2. So I have a wide QRS, RSR prime in V1, and do I have a slurred S wave in the lateral leads? I kind of sort of have one there in lead 1. I don't even have one in AVL, but let's look at V5 and V6. This is definitely a slurred S wave in V5 and V6 that continues in V4 and also V3. So I do have the supporting criteria to have a right bundle branch block. What is commonly associated with a right bundle but a left anterior fascicular block? So our left anterior fascicular block criteria is a left axis deviation, Q1, R3, 1, 2, and 3 are going to be up, down, and down. So let's see if we have all that stuff. We have a left axis deviation. Do we have a Q1, R3? Well, let's look up here. You do have a Q wave in lead 1, and you do have an R wave in lead 3. So we have our Q1, R3. So we have our left axis, our Q1, R3. Now is lead 1 up, 2, and 3 down? If you look here in lead 1, it's pointed up. If you count the positive and negatives of lead 2, it's going to be pointed as a negative QRS. Lead 3 is a negative QRS. So we have all of our supporting criteria now to determine that we have a a right bundle branch block with a left anterior fascicular block. So how do we finish interpreting this 12 lead here? We're going to finish interpreting it by saying that there is a sinus rhythm at 75 beats a minute with poor R wave progression, left axis deviation, right bundle branch block with a left anterior fascicular block. That's how you would interpret this particular 12 lead. Now let's look at our next 12 lead here. If we look at it, the first thing I see is that it looks wide. Calibration, my calibration markers over here on the left side is going to be standard. My rhythm interpretation, kind of an erratic baseline there. Here's some clean baseline in V2 and V3. Looks like I have a P waves that are married to the QRS complexes. And what is my rate? 300, 150, 175. It looks to be a sinus rhythm at 75 beats per minute. And also I notice a wide QRS complex. How about my R wave progression? My R wave progression in V1 is supposed to be negative, negative. V3 is supposed to be negative or transitioning positive. V4 is supposed to be positive. 5 and 6 are positive, but V1 to V4 is positive. So I'm going to go ahead and go with R wave progression is good. My axis, if I look in lead 1, is going to be positive. If I look in AVF, is going to be positive, so my axis is normal. Bundle branch and fascicular blocks. If you look at the bundle branch blocks, I do have a wide QRS complex, so let's go ahead and look at lead V1, because this is where you start to determine a bundle branch block is V1 and V2. Start at the J point and traveling down will tell me that I probably have a left bundle branch block. But let's look at the supporting criteria. Do I have a wide and negative RS pattern in V1 and V2? Yes, I do. Do I have a wide positive RS pattern in the lateral leads? I do. I have a wide, because you have your P wave and then it goes straight up just like that in lead 1. I have it in AVL. I also have it in V5 and V6. And the critical criterion is the absence of Q waves. Do I have an absence of Q waves in lead 1? I do. I have no Q wave in lead 1, no Q wave in AVL, no Q wave in V5, and no Q wave in V6. That tells me that there is right to left septal depolarization. So do I have a left bundle branch? Yes, I have a left bundle branch block. Now, do I have a fascicular block? I can't determine a fascicular block because if you're blocking the left bundle branch, you're obviously blocking both the anterior and the posterior fascicle. So you cannot have a left bundle branch block with an isolated anterior fascicular block. It doesn't happen. So if you have a left bundle branch block, then you don't have to worry about looking for the supporting criteria for a fascicular block. So how do we finish interpreting our 12 lead here? Sinus rhythm is 75 beats a minute with left bundle branch block. It is that simple. This one's pretty straightforward. I'm going to kind of speed it up a little bit through these next two 12 leads here, and then we'll finish up with the presentation. General impression, it looks wide, but it also looks a little erratic up here in this area where the 3 and the AVF are. So, looks wide. Calibration, there's my calibration. So my calibration is standard. Rhythm interpretation, it looks, if I look up here in lead 2, there's a P wave, there's a P wave, P wave. So it looks like a normal sinus rhythm with 300, 150, 175. So we'll say sinus rhythm at 85 beats per minute. R wave progression, if you look at the precordial leads, you have V1 is negative, V2 is negative, V3 is negative, but then V4 looks like it transitioned up to positive, and then V5 is positive and V6 is positive. So we have a good R wave progression. Our axis, we look at 1 and AVF. Lead 1 is positive. Lead AVF is also positive. So I'm going to say that my axis is normal. Bundle branch and fascicular blocks. Well, whenever I do my rhythm interpretation, it looks like to me that this there to there is greater than 0.12 seconds. So because of a wide QRS, I look at V1 and V2. V1 and V2, I start at my J point and I travel backwards. Since I'm going down, that's a possible left bundle branch. I have a wide and negative QRS in V1 and V2. I also have a wide and positive in the lateral leads, and I am missing my Q waves in the lateral leaves as well. So I've confirmed that I have a left bundle branch block. So this rhythm is a sinus rhythm at 85 beats a minute with a left bundle branch block. My last 12 lead is going to be a general impression of irregular. Looks irregular. That was the first thing I saw about it. Calibration. Here's my calibration marker, so I'm going to say standard. Rhythm interpretation. I'm going to look down here. It looks irregular. I'm actually going to say that this is an AFib. Oh, at what rate? We'll say this is a 300, 150, so between 100 and 300, 150, 175, 60, 50. So we'll say AFib at, we'll say 60 to 100 beats per minute since it's variable. R wave progression through the precordial leads. 1 is supposed to be negative and it's positive, positive, positive. So what you're looking at here is an absent R wave progression. Your axis, if you look at lead 1, is up. AVF is down, and it's not supposed to be. It's supposed to be up for a normal axis. So right together, left apart, left axis deviation. Bundle branch blocks, it looks like that we have a wide QRS complex up here in V1. So looking in V1 and V2 for a bundle branch block, Start at the J point, travel backwards. You're going up, which means you probably have a right bundle branch block. Do we have an RSR prime? We do. We have an RSR or an RR prime in V1 and V2. Do we have slurred S waves in the lateral leads? Here's a slurred S wave. There's one missing here, but let's look at V5 and V6. Yep, there's one there, and there's definitely one there. So we've met all of our criteria for a right bundle branch block. Now, what about a fascicular block? Well, right bundle branch blocks are commonly associated with an anterior fascicular block. With an anterior fascicular block, I want to look at a left axis deviation, LA and LA, and I want to look for a Q1 R3. 1, 2, and 3 is going to be up. It's supposed to be up, down, and down. For leads 1, 2, and 3, we do have our right bundle branch block. So let's look. Do we have our left axis deviation? We do. Do we have a Q1 R3? It's kind of tough to tell here. I don't really know if that's a Q wave or not. I can't really tell with this one. But I do have an up, down, and down in 2, 3, or 1, 2, and 3. It looks like I have a left axis deviation, possibly a Q1 R3, up, down, and down. So I'm also going to say that this is a left anterior fascicular block also. So let's finish interpreting our 12 lead. AFib with a heart rate of about 60 to 100 beats a minute with a poor R wave progression. Left axis deviation, right bundle branch block. I'm going to run out of room here. With a left anterior fascicular block. I hope you enjoyed the presentation. Please feel free to contact your lecture instructor if you have any other questions about any of this material. Thank you.